Welcome to Town Meeting TV. You are watching Under the Dome. I am honored to be here today with Majority Leader, Rep. Lori Houghton from Essex.
Yes.
And Speaker of the House, Jill Krawinski, representing Burlington. Thank you both for joining us.
Thank you.
Yeah, thanks for having us. It's great to be here.
So we're here to do a little recap of the legislative session. For those folks who don't know, Vermont has a citizen legislature. It runs from about January, and I think this year, did you wrap up in June? Which was a little late.
We ended in May, and then we came back for a one-day special session in June.
Yeah, and we can talk about that. But so, let's talk about what happened in the last session. There was a big changeover, a lot of new faces in the legislature. And what were some of the highlights that you want to share with Vermonters that you feel proud of, and what are some things that you feel like just didn't quite get over the finish line?
Sure. Well, I'm happy to kick it off, and then I'll probably hand healthcare over to you since that's Lori's bailiwick. But I am really proud of the work that we did to help working families across Vermont. We expanded a child tax credit from 5 to 6-year-olds for $1,000. We expanded the earned income tax credit. We continue to do more on child care. We passed a child care bill several years ago, but every year we tend to it, and we see the impacts all over the state. Like, for example, right here in the Old North End at Robin's Nest, they were able to increase their teacher pay and help them do more professional development. That's huge. Also support the Y. We just saw 80 new slots open up in Milton. So it's so great to see that out there and working to help support families access affordable childcare. We passed a very exciting housing bill, continuing our work.
CHIP, or is this something?
CHIP, CHIP was one part of the bill to help with infrastructure, and that's really exciting because there has been work on a housing development in the South End, the Hula Housing Project you may have heard of, and that is going to be a game changer for Burlington and for this region to have a new huge housing development in a place where we want development to happen. We want to develop more in our downtowns and our city centers and not out so much, and so that was one aspect of the bill that will directly help people in Burlington in this area, more housing, which is what we need, right? And we made some progress in other areas around public safety, continuing to make investments in our court system. As you know, I've talked about this a lot, that we just have a huge backlog of cases in the judicial system. And when COVID happened, it just made it so much worse. So we've been slowly chipping away at getting that backlog down, and that is directly related to some of the challenges that we see in Burlington right now. So I think with the additional investments in our judiciary system, we have 3 new judges. We're starting to see it work, but it takes time. So there are some of the highlights. I will say that another place that we made huge progress is with healthcare, and I'll turn it over to Lori. I think this last session we did way more in healthcare than we did in years, and I know it's going to help Vermonters across the state. So I'll turn it over to Lori to talk about that.
Thanks, Jill. Yeah, it's pretty exciting. And I go back to what Jill said in that we pass legislation and then we tend to it over years. And that's so important for Vermonters to know. These systems are so big that we're trying to change. It takes incremental changes. And so we put forth something, we come back, we make sure it's working for Vermonters, and if it's not, we change it. We've been doing that with healthcare, but this year, as Jill said, we took a pretty big leap. One of the things that we did was reduce drug prices for outpatient settings. So think of autoimmune drugs or cancer treatment drugs, where hospitals in Vermont have been charging upwards of 600% more than the cost of them. And that increases everyone's premiums. And so by passing that bill, we were actually able to reduce premiums by about 4% with what the Green Mountain Care Board. So still high, right? So we're still going to have some big increases this year, but we took some serious steps to reduce that premium increase. And then we also passed a bill, I always forget the act numbers, but S127 was the bill. It puts into place reference-based pricing, which will help the Green Mountain Care Board set rates, which we've seen over other states have reduced costs for Vermonters. And we gave Green Mountain Care Board some additional powers this year. And with that, we were able to dive into the University of Vermont Health Network's budgets and encourage them, and Green Mountain Care Board was able to encourage them to make some changes. And I think that's really important because we need to remember that University of Vermont Medical Center is a huge part of the entire Vermont healthcare system, as are the other 13 hospitals. And so to be able to focus back on the clinical care that Vermonters need will help us drive down costs in the future as well. And then lastly, I would say I want to give a shout out to hospitals. We've been pushing hospital transformation and trying to build a system-wide healthcare system. That now doesn't mean that people are going to be buying people out, but really looking at where the care is being given, what the care is needed in each community, and the hospitals are really stepping up right now and diving into that work with the help of the Agency of Human Services. And we look forward, again, as I said before, coming back to what we've passed, make sure they're doing the good work, and make sure it's helping Vermonters next year.
Can you spend a little bit of time on that last piece of like who's doing this work of looking at that, and how do you think that's going to affect the upcoming year in the legislature?
Sure. So the transformation work actually began before COVID, and then it paused, obviously, because they were really busy keeping Vermonters healthy and safe during COVID. And so what they're doing now with the help of the Green Mountain Care Board, Agency of Human Services, and all of the hospitals and other stakeholders, primary care, mental health, are coming together and saying, okay, we're really rural, and so how do we provide health care at the right place, at the right time, and at the right cost? And so they're looking at regional partnerships, again, not one hospital buying out another hospital, but how can hospitals in a region come together? What is the community assessment? What is needed in that area? And what do they do best? And then potentially, if there's something they don't do best that's very high in cost, does that go to another region, right? And then how do we transport people there to make sure that they can get to where they need to be? So it's a lot of work, a lot of change, but I am pretty excited about everyone being engaged with it.
You know, one other thing that we did that kind of it lives in the health care realm and just helping working families is a medical debt relief bill. So this is a bill that will wipe medical debt and make sure that it's not impacting people's credit scores. We partnered with State Treasurer Mike Pichak on that legislation. It's going to help over 60,000 Vermonters. And so just another example of what we're doing to try to help people in every corner of the state.
So that would be a big one for folks listening. What are the mechanics around that? How do they, when do they expect to see that?
I believe that they will get a notice.
They will get a notice. So there's criteria in the bill as to who can be helped with it. And so the treasurer is working through the mechanics of it. They will get a notification, and then it will be wiped off of their record.
Okay. So the legislation takes place for July 1, 2025.
Right.
But
It takes a while to,
Yeah.
I was curious. I hadn't seen that. Ed reform. You want to spend a little bit of time? I mean, that seems like the thing that people were paying attention to.
And absolutely.
What has been happening over the summer?
So I want to take a step back to talk about what it's been like for the last couple of years, what led us to this. This wasn't something that happened overnight. For the past several years, we've been seeing steep increases in the cost of providing our kids a great education in Vermont. Some of that has been related to COVID, with COVID money disappearing, and schools and communities saying we want to keep some of those investments that we made with that money. So that's been one. The cost of health care for teachers and staff has gone up. So some of these things are not in their control. We also are seeing deferred maintenance out there. So school budgets are going up, and we're also seeing that some of our quality standards haven't been meeting the mark that we wanted. What we heard on the campaign trail last...
Just when you say quality standards aren't meeting the mark, you mean test scores? Do you mean
literacy? Like there, we have a list.
Okay.
And so I think what I've heard a lot over the years, having served in the legislature for a while and have been through several ed reform efforts, where they're saying people will pay for good quality, but as soon as they feel like they're not getting what they pay for, they want to have a conversation and understand what's really happening in schools across the state.
That must be a really hard thing to say.
Yeah.
Because it's really like you're treading on potential morale, you're treading on potential efforts, and schools are bearing the cost of so many more kind of social disintegration.
Right. I mean, we used to have a lot of services outside of schools in the community for kids, and we've brought a lot of those inside the schools for kids, which is really important. You know, we're still seeing the impacts of COVID on our kids across schools, across the state, right? And that's just, it's hard. But what I have faith in is that people are coming to the table to help figure this out. And like I was saying, while we were on the campaign trail last year, we just heard a lot of feedback about the increase in property taxes. And so we went into this legislative session saying, we want to make sure our kids have the best education at a price that we can afford. How do we achieve that? And that's what we set off to do with the governor. I think we created a framework to ensure that this is a 3 to 5 year process where we're going to look about scaling our education services, looking at, we have things in that bill like minimum class sizes that we know will reduce costs and provide better outcomes, for example. We changed the way that we fund education in this state with a foundation formula, which is very technical, but it's a more transparent way to look at how we support our schools. And so this is the beginning of this education journey that we're on together. We have a task force that's working on new school district maps that's in the works. Who's on that
task force?
So it's a mix of legislators and folks with experience in the education field. So co-chairing it, we have Senator Martine from our community, and then Representative Edie Granning from Jericho. So they are leading this, and they are working so hard to get us those maps to take up next session. And then we also have the future of the Public Education Commission that's really working on a good outreach effort across the state. We want everyone to be at the table telling us, like, what do they want their schools to look like? Where do we need to look at sharing services? You know, I think a lot of the conversations between public education and healthcare are so similar. Folks love their community schools. And for some places, that is their community, the school is the heart. But maybe they don't have the population to meet that. So what can we do to ensure that that building still stays as the hub of their community in different ways? Maybe it's housing, maybe it's a community center, maybe it's a child care center. So there's so many kind of aspects and conversations that are taking place over this summer and fall to help prepare us and kick us off in January.
And I think the only thing I would add is that we have an amazing workforce in our schools. Not only teachers, but everyone who staffs and supports the teachers, the mental health workers who work in our schools. And we value that. And there's so many more people in the legislature now than even when I started 9 years ago who have kids in the school system. And that's why I ran. Because I had a kid entering the school system, I'm like, we need their voices in here. And so I want to make sure everyone knows we do want to hear from people. If you have questions or concerns, reach out. Like we value what's happening in our schools. But as Jill said, we need to make sure the quality is there and it's a cost we can afford.
And we have a lot of resources available too, because there's so much. And so if you go to our legislative website, just Google Speaker of the House, we have resources on our webpage to help navigate. We have an FAQ, we have videos
to navigate the reform
to understand
process.
What's happening. So I just want to give a shout out to that. Thank you.
Tell me a little bit, like just back up a little bit, the emphasis on property taxes as the place that is the leverage point. How did that become the place that we're focusing our attention? Not cost of living, not rising cost of healthcare, not, right? So there are all these other stressors in people's lives. And this is coming from me, raised by parents who are like, you always just pay, you're happy to pay higher property taxes because it pays for services, right? So that's just the transparency of where I come from with that question. And so how are we focused on that as a community rather than pushing back on other ways of generating revenue to support services in our community?
Well, I would say first off that it's not, our focus isn't just property taxes. Like as you just heard, Lori talked about all the different ways that we are focused on trying to stabilize healthcare costs in our state. And that is a huge stressor on families. And we have some changes that are coming from the federal government that are going to make it even worse, that we're going to have to deal with premium assistance, for example. So I don't see this as just property taxes. I see this as us tackling stabilizing the costs for education and improving quality. I see us tackling healthcare and stabilizing that system. And I see us really focused on housing. Housing is like these are like the three things we're constantly talking about and investing in. And so, you know, we also have a political reality that we live in. And our governor doesn't support any sort of tax increases. And so I think some of the conversations that we could have in that area, we just were limited because it just couldn't happen. And so our focus is what can we do to make a difference in Vermonters' lives.
And it is the one place that people see a direct place out of their pocket. Like the child tax is sort of hidden in your payroll, and often your employers are picking that up. Or the estate tax is not something that people are. You're not seeing that every month, or I mean every quarter.
And I think that the demographics have changed, right? We've gone from 120,000 kids to 80-some thousand kids. Our population is getting older, so they don't have kids in the school, and they get that property tax bill twice a year. They see the effects, and it's hard on them because of all the other costs that are increasing as well.
Great, thank you. Spend a little bit of time talking about what you're expecting in this upcoming year. And, you know, I think folks, of course, want to know how we're responding. You alluded to premium hits. I know folks have probably gotten, if they're on
Vermont
Health Connect, they've probably gotten that, like, be aware that your premium may change come January.
So that is, so that is coming in October. Notices will start going out to folks who buy off the Vermont Health Exchange. I'm one of them. I get subsidies. It is going to be very difficult. If we lose those subsidies, that's a $65 million impact to Vermonters.
Why are we going to lose the subsidies? Tell us.
Sure. So during COVID, during the pandemic, the federal administration put through federal enhanced premium assistance. There's always been some assistance. And so it went from maybe 200% up to 400% of poverty level that folks can get assistance. So that means that when you sign up for Vermont Health Connect in November and you start your plan in January, you either are getting a subsidy that reduces your premium each month, or when you file your taxes, you can say, this is what I spent, and depending what your income was, you get a premium back. And so, for instance, for me, we went from paying about $2,000 a month to under $100 for our premiums. Now, healthcare is still expensive, right? We still have high deductibles, and so there's still an affordability crisis here. And so with when that passed at the feds, it was due to expire at the end of this year, and it is now basically what is happening at the federal level with the potential shutdown, in that there's a fight over not whether we keep them or let them expire.
Yeah. What are some other ways that you're hearing from Vermonters about federal impacts? I know there's been joint fiscal committee hearings specifically on this issue. You know, Vermont Public lost funding from the Corporation for Public Broadcasting. We've heard little bits about SNAP benefits, effects on refugees and immigrants. HUD, CDC.
Yeah, Section 8 housing has been one that's also been taking a hit that we will need to look at when we get back into session. You know, we are hearing a lot around the healthcare concerns and housing concerns, and those are places that we've already identified as priorities for us next session. What our Joint Fiscal Committee is doing is hearing lots of testimony to better understand how does the federal tax and spend bill impact us. What do we have control over, and what will we have to fill the gaps in? And
is there anything that's standing out to you?
I mean, healthcare.
Healthcare is probably
the biggest by far. And I know right now in Washington, the Democrats are trying really hard to reverse that in these budget negotiations. I don't know if they will be successful. I hope they are, but that is it's going to have a huge impact on Vermonters across the state, and that is definitely one that's keeping us up at night.
And so, what's the proactive approach? How are you working, with your other legislators?
Yeah. So we have the Joint Fiscal Committee doing this work, and as they're taking in testimony, they're reaching out to the chairs of our policy committees, our housing committee, our healthcare committee,
Human services
for sure, to say, here's what we're hearing, here's some more information that we need to help you get ready for next session. So you'll see the Joint Fiscal Committee meeting, and now in a couple of weeks, you're going to start seeing House committees holding a one-day hearing to talk about, okay, what's happening in human services, what are we going to do around housing to better dig in so that when we get back in January, we can hit the ground running.
Interesting. And so that's an unusual thing for these committees to convene and meet. What's the political process? How, like, is that, who's saying, go ahead, meet, listen to what folks have to say?
Sure. So we have done different scenarios like this in the past, but what we're seeing is that it's impacting so many different policy jurisdiction that we need to have more meetings. So that would be the difference from prior years. It's usually, you know, we have to focus on some public safety concerns, and so that committee is just very focused. This is multiple committees. So I'm coordinating very closely with our Joint Fiscal Committee and our committee chairs to figure out who should meet and when, timing because of what's happening in Washington, to help prepare us for January. So that's the work that we're doing on the House side to prepare. I think one or two of them might be joint hearings with the Senate as well. And we're also working closely with the administration to say, when we get back into the building next session, we can't do our budgeting process like we used to. This is so big and so different. And so we have the chair and vice chair of our House Appropriation Committee meeting with the administration to say, this is how we're going to work on building the budget. And we need to do this together. And we need to make decisions informed by good data, data that is reliable so that we are making good decisions. And so that is a process that is underway and that will help us really be set up to hit the ground running when we come back into the building in January.
Yep.
And if I can, I would just say, and I think what's important for Vermonters, everyone's anxious, right? We're anxious too. You never know what you're going to read in the paper. Yeah. And I've talked to constituents who are like, well, can you do these things? Well, we can't do a lot until we're back in January, which is why it's great that the speaker is convening these committees to start having those conversations now so we can hit the ground running. And I just want Vermonters to know we are listening to them and we're going to do everything we can to protect them. And hopefully everyone can just take some deep breaths like we try and do every day.
We do, we really do. And I will say that that is such a theme out there. Folks are so worried. There's so much anxiety and fear about what's happening in Washington, and things are just not how they were. We are in like this new time and this new era, and we really have to be extra vigilant and just be listening and responding to people's concerns. And I'll say I am so disappointed and concerned. Like, we're already seeing the Trump campaign come into Vermont. Americans for Prosperity. I just brought this as a, I just want people to see that the Trump campaign is already in Vermont and they're campaigning against us in the House and in the Senate. So they're sending out these mailings with misinformation, things that are not true, and that's happening
Give
now.
us a little run through.
So they're saying that,
deconstruct this for us. Tell us what how you're seeing this.
So what I hear on this is that they're telling people we're raising their taxes, and that's absolutely not true. And this just boils my blood, because right now the last thing Vermonters need is misinformation and more things to concern them and cause fear and anxiety. We don't want to do that. So when they're saying things that we're raising their energy or their grocery prices, like, I can't control what gas costs when you go to fill up. I can't, there are things that are not in my control, but the things that are in our control, we are working on and we are making progress on. And so I just want people to know that, Trump's people are here in the state and they are already campaigning against us. And so I want people to be aware that that's out there and that it's unacceptable and not okay.
And let's just remind people who the Trump people are. They're billionaires. Yeah. They're billionaires who are putting money into our state to say all these things about Democrats that are not truthful. And we're trying to work with everyone across the aisle to really help Vermonters be able to thrive here in this state. And that is what we are focused on.
Yeah. And I mean, to be fair, we are going to have to find different ways of raising revenue, whether that's taxes or fees or. So how do you push back on that in this climate? How do you push back on that in the climate where you have the no new taxes mantra
Yeah.
gets people's attention?
Well, I'm always just showing people what we're doing that's helping them in their communities.
Yeah.
Like, for example, I was just in Middlebury earlier this week, and we talked about the new housing developments that they're seeing in their community, the new childcare slots that are open in their community, how for families, our supports for them to send their kids to childcare is helping
Yeah.
them. So I'm constantly sharing with people the progress that we're making and not to get distracted by misinformation and just to look around to see, okay, this is what's working, and that's what we need to stay focused on.
Now, one of the things that we did is that we asked we had a conversation yesterday with the Senate Pro Town, Phil Bruth, and we asked a question that you had posed to him in that conversation, and then he had a question posed for you, which is on Town Meeting Day, Burlington voters overwhelmingly voted in support of a local charter change that would prohibit guns in bars. S-131 is a bill that would enable the charter change. It passed the Senate in April and has resided in the House. Are you committed to bringing S-131 to the floor for a vote next year? And I guess rather than a yes or no is just, can you talk about that and respond to that question?
Absolutely. So first of all, I'll say I voted yes for that charter change. I support it. I believe in it. We don't have the votes in the House to override the governor's veto. And so in the vein of things that we can do that will make a difference, that we can get across the finish line, that will help Burlington and our communities surrounding here, that's going to be my focus. I know that the governor has been in town talking with different businesses, talking with different business groups and advocacy groups, and I hope that he's hearing from them that this charter change is important to them and that they want him to sign it. That's where I need help. So if you live in Burlington, if you own a business, if you work at a nonprofit, if this is something you care about, please reach out to the governor's office and say, support this charter change.
Tell us a little bit, for those who don't remember, this is expanding. Right now, somebody can walk into a bar and have a gun, and this is saying...
So businesses can put up notices, right? You see the notice, like you could say no guns, no shirt, no service, right? They have the ability to put that up. So they can do that right now. What they're saying is make it like a law to say you can't bring guns into bars. You know, I think there's so many different challenges that we have right now. I think this will help. I think there are other things that will also help and make a bigger difference too. And so I think we have to be looking at all these different strategies and how we can help. That comes back to like services in our community that are so deeply needed right now. More support from mental health challenges. I know we have the new day support system at UVM, which I'm thrilled about, and we're seeing progress made there. I think we have to look at the whole picture and not just focus on one thing. But again, I support it, and I need people's help contacting the governor to get him to support it.
As Democratic Majority Leader, what's your biggest challenge in this upcoming year? Tell us, like, for folks who don't know.
What I do?
Yeah, what's that? What is that role? And what's your?
Sure.
Yeah. What are your?
So I view the role. This is my first year doing it. I view the role as helping our caucus members be successful for their communities. So they're all out talking to their neighbors, talking to their constituents. They bring their priorities back to the State House, and my job is to help them get things done, whether it be actually legislation or, hey, how can we do something without legislation to help whatever the needs are in your community? And then helping with communications to make sure that the Democratic message is getting out, and just making sure that we're doing everything we can for Vermonters.
And people are getting your ear. I mean, you must. That's one thing that you must get waylaid in the halls
all the time. Yeah, I mean, people. We're there January through May. You said that in the beginning. These are really full-time jobs for the most part. I mean, even our members are out there. They've been out there this summer, this fall. They're doing community town halls. They're knocking on doors. They're listening to people's needs. And that's to ensure that we can come back strong in January and keep working for them.
And just to close, this session will open in January. You'll get into another round of lawmaking. You're looking at hundreds, near on 1,000 bills, right? Usually in a session. And you're hearing from a lot of people. All the work takes place in, for the most part, committees, and then through these conversations. Who are you not hearing from? Who is not in the room that you feel like you would like to hear more from? Or you feel like, oh yeah, things are covered.
No.
I wouldn't say things are covered. I mean, I always come back to making sure that we're hearing from every community across the state, because sometimes there can be a small but very vocal group that takes up a lot of space in the room, and it's important for us to step back and say, who's not here? Is it older Vermonters? Is it parents with kids? Is it high school students? You know, we really have to make sure that everyone has a seat at the table and we're not missing anyone in what will be a very challenging session with the budget and with services, given the dynamics with Washington.
And I would also say to people, we are very accessible,
Yes.
right? I mean, reach out to us. Like, if you are not being heard, take a minute, email us, call us, whatever you feel comfortable, however you want to make that connection. House members are extremely accessible to people in their community, no matter who you voted for, right? Like, we want to hear from you.
Well, thank you both for joining us, and good luck with the rest of this sort of off-season session where you're still doing work.
Thank you.
Thank you all for watching. This has been CCTV, Town Meeting TV's Under the Dome. You can watch this and other programs at cctv.org or at on our YouTube channel at youtube.com/townmeetingtv. Thanks very much. Take care.